Let me start with something many people misunderstand. A cataract is not a disease that appears overnight. It is a slow, natural change inside your eye, but that slow change can quietly steal your vision if you do not understand it early. So, what exactly is a cataract? Inside your eye, just behind the colored part, the iris, there is a clear natural lens. This lens works like a camera lens. It focuses light onto the back of your eye so you can see clearly. When you are young, this lens is transparent like clean glass. A cataract happens when this clear lens becomes cloudy. Not suddenly, not dramatically, but gradually. And as the cloudiness increases, your vision becomes blurry. That is the simplest definition. A cataract is a clouding of the eye's natural lens that affects vision. Now listen carefully. Many people think cataract is a film that grows on top of the eye. That is not true. The cloudiness is inside the eye in the lens itself. That is why eye drops cannot dissolve a cataract. And that is why wiping or washing your eye will not make it clear. So how does cataract affect vision? At first, you may notice small changes. Your vision looks slightly blurred. Colors appear duller. Lights may seem too bright or cause glare at night. Reading becomes harder. You may feel like your glasses are no longer strong enough. Many people describe it as looking through a foggy window. Slowly, that fog gets thicker. Who gets cataract? The most common cause is aging. As we grow older, the proteins in the eye lens naturally change, causing cloudiness. That is why cataracts are very common in people over 50. But age is not the only cause. Other causes include excessive sunlight exposure without eye protection, diabetes, smoking, eye injury, long-term use of certain medications like steroids, previous eye surgery, family history of cataract. So, cataract is not only for the elderly, it can affect younger people too. And now let me slow this down. Cataract does not cause pain in most cases. That is why many people ignore it. You can't have significant vision loss and still feel no discomfort. That silence makes cataract dangerous. Here's something important. Cataract does not make you permanently blind on its own, but it can make everyday life extremely difficult. Driving at night becomes scary. Reading becomes frustrating. Recognizing faces becomes harder. Working becomes challenging. Your independence slowly reduces. So, what is the treatment? The good news is this: cataract is treatable. The only effective treatment is cataract surgery. During surgery, the cloudy natural lens is removed and replaced with a clear artificial lens. It is one of the safest and most successful surgeries in medicine. Many people see clearly again within days, but timing matters. Early cataract may only need stronger glasses and regular monitoring. Surgery is usually recommended when cataract starts to affect your daily life. Not too early, not too late. It is about the right time, the time when your quality of life matters more than fear, delay, or denial. Now listen carefully. If your vision is becoming blurry, cloudy, or dim, do not assume it is just old age. Do not normalize what is not normal. Do not adjust your life to poor vision when you don't have to. If you are struggling to read, if lights bother you at night, if faces look unclear, or if your world feels dull and foggy, that is your eyes speaking to you. Get your eyes checked. A simple eye examination can confirm if you have cataract. No guesswork, no confusion, just clarity. And if cataract is present, your eye doctor will guide you on the best next step. Let me slow this down and bring this home. Your eyes carry your world. They hold your memories. They help you recognize the faces you love. They allow you to work, learn, create, and move through life with confidence. Your vision connects you to everything that matters. Cataract may be common, but losing vision does not have to be your story. You do not have to accept blurred vision as your destiny. You do not have to live in a fog when clarity is possible. Understand it early. Knowledge gives you power. Awareness gives you control. Check your eyes regularly, not only when something feels wrong, but as part of your overall health. And when you need care, seek it without fear, without delay, and without excuses. Because clear vision is not a luxury. It is your right. Your right to see your children grow. Your right to read, drive, work, and enjoy life. Your right to experience the world in full color and clarity. So take your eye health seriously. Protect your vision today so your future can remain bright. Live well and value your sight. See well